Hello, welcome back to the channel. My name's Dan. I am a doctor here down in London. I work in St George's and I teach PACES. And today, this video is going to be about PACES. If you haven't seen the previous video, which is basically a two-part series of the TLDR of the webinar that I did last Sunday, and the webinar was about how to revise for PACES. How do you approach the PACES exam? The bigger picture stuff. If you would like to see the full webinar, I highly recommend it. Go and sign up for that. The previous video, well, we talked a bit about the fact that PACES is a performance. PACES is an act, and what I want you to think about is being a detective as well as a ballerina at the same time. So that's the first identity that I want you to adopt. The main point that I got across in the last video is that if you don't find the right facts, but you look really pretty, you will fail. And equally, if you find all the facts, but you don't do it in the certain way that they want, you will also fail. And that is the crux of PACES that people don't really appreciate. There are many other cruxes that I will talk about. Today, I want to go through the different scenarios that you get in your PACES exam. And the first one is the clinical systems examination. This is your cardio, your resp, your neuro, and your abdomen. When we're doing this, the mark scheme is really helpful. So in the mark scheme, it says that there is no marks for clinical communication in this station. So your introduction should be really short and sweet. Who you are, gaining consent, are they in any pain? That is it. And then exposing them properly, bit of talking then, and then you don't need to talk to them again. You just have to instruct them to examine them, okay? So the way I want you to think about yourself when you go into this one is to be a detective. This is definitely a fact-finding one. So you have 6 minutes, you're under a lot of time pressure. Really, you have to find the diagnosis. So you are searching for clues in this. You are efficient, you move with pace. You're always polite, you always gain consent, you ask about pain, and then after that, you are non-talkative and you're preoccupied with looking for those signs. Anything that you pick up that may be slightly out of the ordinary, you follow it up. You're thinking this could be the thing that cracks the case. And I really want you to do that because sometimes people pick up signs and then they don't think, okay, so what's the next thing? So they find a fistula, think, okay, this is a renal patient, obviously. But they don't really look for neck scars or they don't really look for abdominal scars. And as you do PACES more and more, you will figure out that there are certain things that you should follow up with. But the idea that if you find anything out of the ordinary, I want you to then think about, okay, so what is the next thing? What's the next clue that I need to try and find? That is a really important thing to take into the exam when you're thinking about the identity that you adopt in these shorter stations. So that's our first station. The next station is a communication station. These are 10 minutes. It's going to be you, an actor, you and a patient. And realistically, probably one of them is going to be breaking bad news. And then another one may be an explanation or whatever. The idea or the identity I want you to adopt when you go into this station is that of a counsellor. So compared to the last one, where you're a detective, this one you have all the time in the world, okay? So it's just you and the patient. You have all the time in the world. You're nice and slow, okay? You make them feel welcome. Your body language, it just sort of invites them to come and talk to you, come and tell you things, okay? You nod your head, use, you make little noises to show that you're actively listening. And you're really kind, really quite nice. You're smiley, you're welcoming, offer them a chair, things like that. As well as being kind and empathetic, you're also a very effective communicator. So that means that you structure your consultations. You think about the time of the consultation, you think about the next steps after the consultation. You do that all with purpose. You're very purposeful in your structure. And equally, although you're very kind, you're also willing to challenge your clients. You do it politely. You sort of say, oh, that seems to have upset you. You make observations about the patient and their body language and put them back to them rather than saying, oh, why are you getting angry? So you're non-confrontational, but you are willing to challenge your client. The way you do that, and your secret weapons are things like non-verbal communication and silence. Use of silence can be very effective, and these are the tools that you use. So that is what I want you to think about when you're going into this one, is slowing things down. You're the counsellor. You're just super nice, super warming, super inviting, but also you're very effective. You can structure a consultation really well, and you're not afraid to challenge your clients. You don't want things to go sour, so you do it in a very sensible and clever way. But yeah, you're a very effective communicator. That is our second one. The last one is the clinical consultation. So you have two of these. You have station 5 and station 2, and these are 15 minutes where you do a history and examination, and then in the last 5 minutes you also have a viva. In this one, I want you guys to be the geriatric registrar. And this is the kind of doctor where you are on a ward, you've got so many things going on, and then this doctor walks through the door and you think, oh, thank God, this doctor is unreal. I'm so glad I'm on shift with this doctor. That is the doctor I want you to be. you are that doctor now. You're the geriatric registrar. So you perform a very thorough history. It's got really good structure as well. And your examination is very thorough. You spread a very wide differential. I want you to think about all of those geriatric reviews where they just have lines and lines, and they start with the most common things and they're really sensible, but they also think about rarer stuff, and they just demonstrate that great knowledge of medicine. They think about polypharmacy. They know all the drug side effects. So that's the thing I want you to do, is spread such a wide net when you're thinking about it. Start with your really common things, but keep that wide net. Not only that, you then have your stepwise sensible investigations, starting with the bedside, thinking about, the geriatricians, they have very old patients. They don't do stuff to them that they don't need. So that's the kind of pragmatic approach I want you to take in your investigations and your management plan. The next thing is that you're holistic and compassionate. And you're thinking about other things. You're not just thinking about medicine. You think about the discharge. Are they going to be able to do their ADLs? Actually, do they have capacity? You're thinking about their family, their next of kin, all of these things. And you're the kind of doctor that doesn't forget DREs. You're the kind of doctor that takes a really good collateral history, and you keep the patient and the family, well, the next of kin, up to date whilst you're making the management plan. That is the kind of thing that I want you to embody when you walk into the station. Is I want you to be that doctor. Obviously that's quite an ask, but I do think having these identities is really helpful, because it just gives you an idea of the different skills that you need to be showing. And obviously the consultation station is a bit more vague. You don't know what they're going to throw at you, and essentially they want you to be safe and effective. And I think there are many really good doctors, but the geriatricians, I think they have to navigate some extra things. That means that they are very thorough, very holistic. They're also pragmatic, and that's exactly what they want to see in the consultation stations. The last thing I will just say about when you're going into your PACES exam, and this took me a while to realise, is that when they are examining you, they want you to be the reg. And this is something that actually a lot of SHOs haven't really thought about. There may be an IMT one. I was like a locum. So when I was at this PACES teaching and this consultant said, give me a bit more, I need an opinion. You're a registrar, I need an opinion to work with. Before then it was kind of like a police interview when he was doing a Viva with me. It was like, no comment. And obviously they can't pass you if you do that. So what I want you to think about is trying to be the reg. You have to make a decision. You have to stick your neck out there and say something. That took me a while, but there is a bit of an act with the Viva, I think. As much as, sometimes when you don't really know what's going on, you can long out your blood tests, you can buy a bit of time, this kind of thing. Equally, examiners, they're going to just want to have a conversation with you. And so you don't really want to do that too much, especially if you know what the topic, you think you know the diagnosis, or you're really well versed on the topic. Show them your skills, So that's the thing I want you to think about as well. So you're a detective, you're a ballerina, you adopt those 3 different identities, but ultimately you are now a registrar. And so you give your medical opinion. That is a really key thing. If that was helpful, then you should go and check out the full webinar. I really highly recommend it. We go through so much more detail. The other thing that you should do is go check out the PACES Academy. This is what we will be doing, and we have a couple of upcoming events. So the first one is going to be next Tuesday, the 14th of April. We're going to be having a look at how you should use PACES video resources. So the past test one is the most well-known, and in my opinion, I'm not sponsored by anyone, but how you should go about revising with them. So if you go and look at the answers straight away, you're not going to get anything out of it. How do you maximize that tool? How can you maximize your time? What approach should you be taking? So that's the first seminar, and the second seminar is on the Thursday, and that's going to be having a look at how to break bad news. So this is going to come up in your exam, and it's a nightmare if you don't have a structure, and it is an absolute breeze if you have a structure. So let me show you what that is like. Those are both going to be live in the PACES Academy. They will not be available on YouTube, but I look forward to seeing you in the PACES Academy. If you haven't already, have a look at this video here and have a look at the last one there.